Assalamualaikum warahmatullahi wabarakatuh, and good evening, ladies and gentlemen. In the next 15 minutes, I'm going to try to share with you my hypnosedation experience in UMMC. And this is about Datin B. And Datin B was referred to me by Dr. Mansor, who is a hypnotherapist, for a continuation of hypnosedation care. And this patient has recurrent basal cell carcinoma on her forehead, and she was scheduled to be done under local anesthesia, the excision to be done under local anesthesia. And her psychological issue include anxiety, phobia, and trauma of the upcoming local anesthetic procedure. Yeah. So this patient actually had multiple surgeries done before under general anesthesia, and all of which she was very comfortable with and very receptive. So, however, for her last surgery of the removal of the basal cell carcinoma, it was done under local anesthesia. And this is the first time that she experienced surgery under local anesthetic. And she was traumatized when the local anesthetic was injected around the nostril region. So she described the experience as like being suddenly struck by lightning, and the pain exploded intensely and deeply into her brain and shook her entire system, and she was helpless to do anything. So because of that, she was emotionally not agreeable to do another procedure under local anesthetic, and was initially insisting for general anesthetic, but was advised against it as her BP was labile during the previous GA, and furthermore, the case is a minor operation. Given her age and comorbids, the risk of GA is a bit too high for a minor operation. Therefore, she finally relented to have it done under local anesthetic, but was very unhappy about the decision. So deep down, she was actually very scared, and she would be struck helpless as she experienced another repeat of the intense pain during local injection. So to prepare her for this hypnosedation, she had to undergo at least 3 sessions of hypnotherapy before we subject her to the operation. And for the first session, it's about socializing to hypnotherapy model. So she was taught self-hypnosis and became quite excited to know that this was a tool that she could bring with her into surgery to help empower her to control her level of pain and anxiety. And then the second session was done 3 days later, and this is about desensitization and trauma work. So in this session, one session of eye movement desensitization and reprocessing therapy, like what Dr. Lata talked to you earlier on, or also called EMDR, was done on the memory of the trauma of the intense local anesthetic pain. So what happened is, we taught her, instead of resisting re-experiencing the explosive pain of local injection, that's the one that is maintaining her anxiety, phobia, and trauma and whatever, she learned to confront the traumatic memory and open herself to accept and surrender to it. So after the EMDR, she was able to say, even if the same painful experience were to repeat with this upcoming surgery, I now have the resources to empower myself to cope better. So 5 days later, she had the 3rd session, and this session is on hypnotherapeutic rehearsal of the upcoming surgery. So specific hypnotherapeutic protocols were rehearsed with her so that she can practice it. And she is now mentally prepared and even a bit excited to go for the surgery, knowing that she now has access to tools to help her induce self-hypnosedation. So on the day of the operation, in the operation theatre, as a hypnoanesthetist, I guided her to self-induce herself into hypnosedation as rehearsed in session 3 during her surgery under local anesthesia. So the expected results are of course patient dependent, but with those who are hypnotically gifted, self-induced hypnosedation can bring about a GA-like experience without triggering risks of hemodynamic instability or respiratory depression that inherently comes with chemical anesthetics. But in her case, the blood pressure dropped a little bit when she's in trance or under the hypnosedation, but it's not a big problem. So in this case, hypnosis serves as a sedative, but local anesthetic will still need to be administered as to induce anesthesia. So before administering hypnotherapy, we have to know a little bit about the patient so that we can put it in our script when we are trying to suggest the positive goal. Yeah, and for Datin B, currently her main goal in life is to live a life free of tumor. So when that happens, she will feel the lightness of being and enjoy good companionship and quality relationship with friends and family members, as well as enjoy spiritual connectedness with nature. She loves gardening and all that. So this is what she wants. This is her goal. And we are merely trying to help her to achieve all that. And then we also have to find out, are there any resources that are going to help us and help her cope with the problem? So in her case, we are fortunate that she is a trained Reiki healer, familiar with healing energy ball technique, as well as pyramid of light technique. This is all her own techniques that she used, and because of that, we take advantage of this. And when we in the hypnosedation protocol, we use this healing energy ball as during the induction. So during the induction, we say to her that you are already familiar with the arts of Reiki healing. Take this moment to silently repeat your usual Reiki mantras to yourself and connect to your higher consciousness. Come from the intention to open yourself to cosmic and universal energy and to allow this energy to flow through you and become concentrated as a ball of healing energy in between your palms. So we make her concentrate on that. And then we make her relax by going down deeper and deeper into trance. So we say, so ready? Taking the first step now, and we count. 10, 9, enjoying the very beautiful scenic walk along your pathway. 8, 7, going down, deeper and deeper. 6, 5, 4, feeling peaceful and tranquil as you move along the pathway. 3, 2, 1, all the way, deep, deep, down, relax. Finding yourself at the end of the pathway, step off the pathway and step into your favorite place of relaxation. See the full beauty and vividness of the colors in your favorite place. Hear the gentle, peaceful sounds of nature. Feel the peaceful and tranquility of your favorite place. If the patient at this point does not appear to be in deep trance, meaning looking peaceful and motionless, but instead appearing to be a little restless, some minimal IV sedative, quarter to half the usual dose, can be administered at this point. But in this case, I didn't have to. She was nicely in trance. Then we have to then set up the dissociation, reframes, and add the time distortion and amnesia into the whole thing. And then I said, the beautiful thing about hypnosis is that you can remain in your favorite place. Your body needs to be in the operating theatre, but you don't have to. And so you can surrender your body fully in the hands of experts who will help you heal and become tumor-free while you remain safe and sound in your favorite place. Of course, from time to time, you may become conscious of what your body is experiencing. Sometimes you may be aware of a certain tingle or warmth or pressure or tugging and pulling. But you pay no attention to these bodily symptoms and instead choose to refocus your attention back to your favorite place. And the more you choose to remain in your favorite place, the more control you have to push away any unpleasant sensations your body may experience. And because you are now more empowered, more in control, you will no longer re-experience the administration of local anesthetic in the same way again. You pay no attention to your bodily symptoms, but instead choose to listen to the sound of my voice, the sound of my voice that will guide you to continue to remain deeply relaxed and deeply in trance. And then you add this time distortion thing and you say, and time will pass so quickly. Every passing minute will feel like mere seconds. Time will pass by so quickly that you will not even notice the passing of time. Before you know it, you will find that the surgery is already over. And there will be no need to remember anything that happened during your procedure, so that when you awaken, it will seem like you merely drifted off into a pleasant sleep of which you awaken feeling refreshed. So intraoperatively, you will tell her, in a few moments' time, the operating staff will take the necessary steps to prepare your face for surgery. You pay no attention to them as you continue to focus on the sound of my voice. And it doesn't matter how deep a trance you go into, you will always be able to relate to the sound of my voice. The sound of my voice that will accompany you throughout the entire procedure. So once the operation is over, you will then have to wake the patient up. And before you wake the patient up, you put this into their thoughts. Yeah? You will awaken feeling fine, refreshed, rejuvenated, with a sense of pride and achievement because the tumor has been successfully removed. You look forward to living that life free of tumor to fully enjoy quality connections with friends and family members, and also have a deeper spiritual connectedness with nature. Every part of you will be back here with me in the present, and all normal sensations will be restored to your body, except the areas which underwent surgery. These areas will continue to remain comfortably numb. So that recovery will be comfortable and painless, and you will awaken with a renewed sense of rejuvenation. So ready? Ready to wake up? 1, 2, 3, waking up, waking up. 4, 5, 6, waking up, waking up. 7, 8, open your eyes. 9, 10, wide awake, wide awake, wide awake. So the hypnosedation and surgery was successful and she was discharged well. So feedback from her daughter revealed that she was satisfied with the procedure and was out and about in her garden in the same evening. See if you can watch the video. The sound?
Your was she had feared for an upcoming surgery, and that was a while ago, and we brought her for hypnotherapy to address the fear of the surgery. And what was your experience for you bringing mom?
She had a bad experience. It's in a medical situation, so she thought that she wanted to try hypnotherapy, and she was very confident in it. So that makes a difference, you know.
I felt really good and under this, and I felt very calm, and I did not have any pain. I could feel the doctor moving about, doing things, but it was very good, and it was very comforting also having Professor Marzida next to me, guiding me. That was really great, yes.
So the the surgeon that operated on Bridget, and how was the experience bringing a patient going under hypnosedation as compared to the usual cases of the okay?
I think the patient is calm and it's more under control. It is more calm when we do the procedure. I think not only the patient, but we also need a lot more calm in the sense that because we leave the patient in calm situation, so even the surgeon has to be, slightly relaxed and not expediting unnecessarily.
What was the experience like for you when you went through this surgery?
I think it's a new experience in the sense that I can foresee that other modalities of how to treat patients in the sense that because usually we just employ either sedation or general anesthesia or local anesthetic. So I think hypnotherapy is a good adjunct in a sense. I mean, I think it's one way to move forward the patient in giving some sort of pain control during surgery.
I myself initially a bit skeptical whether it's going to work or not, but when I actually did it, the result was amazing, and I attribute it to the fact that there was adequate preparation and correct selection of patients as well, and I was amazed at how easy it was for me to actually administer the hypnosedation, even though that was my first time doing it in the operation theatre, because I usually do it in the pain clinic for chronic pain patient. This is the first time I'm using it as hypnosedation, and the result was amazing.
Because of this memory of that previous surgery, when you knew you had an upcoming surgery, you became very fearful, and that was before any hypnosis was administered. And after that hypnosis was administered, there was more confidence, there was more calmness. How did hypnosis help to change, to make the fear go away?
I don't, somehow if you just had the confidence to face it, that it would be okay, you know? It was not like before you sort of anticipate pain, you anticipate, it's going to be long time. And this time there was none of that. I anticipated it should be good and not have any pain or very little, so it was very different.
So this was a complete difference. I was quite shocked. I was amazed.
This was on the day of
On
surgery.
the day itself, that's amazing. Normally it's like, have to help her, slowly, and, have the care. I knew that she'd be able to look after herself, she feed herself, and all that. Otherwise, I was already prepared, with food delivery and everything.
Right. After the operation, how much painkillers did you take?
I take none.
None at all.
None at all. I hardly had any pain. It was a little bit of an ache, but it wasn't even like a headache. It was very minor. So I did not really need any painkiller. And the next day I had no pain ever since.
What is your recommendation and opinion with regards to the use of hypnosis in anesthesiology and surgery?
I think it is really a great thing to have it because it prepares you to be less worried, no anticipation of coming pain and things like that. You can face it with confidence that it will be good, and that you can do it, quite happily.
What is your advice for your patients when surgery?
I would say if you go for a little bit of particular, but even on the general, it's a good idea to have a course of clinical hypnosis because, that will put you in a state of mind to face what's coming without fear. Yes. So I'm confident and not be worried about it. And people like operation, they say, oh no, what's going to happen? So if you have hypnosis, all that kind of fear will be gone.
So in conclusion, research has shown that positive effects of hypnotherapy for acute and chronic pain reduction and management. And hypnotherapy can be added as a modality in pain management along with other treatment. So mind over matter is how thought processes can influence our physical reality. But in health, it isn't just mind over matters, but mind matters. Thank you.